So as far as the opportunities for the healthcare management professionals is concerned, we have more than 70,000 hospitals across the country, big and small. There are a large number of medical devices companies, clinical research organizations, insurance companies, telemedicine companies, new age health tech, medtech companies, medical value travel or medical tourism companies, pharma industry. See, all these industries require people in operations, marketing, branding and PR, HR, IT and other allied healthcare professionals. Even some of the big IT companies such as Infosys, TCS, Cognizant, they also require a large number of these professionals, catering to the Indian, European and American market. So I see opportunities galore for well-trained professionals in future.
I think healthcare or hospital require a multi-specialty hospital managers. See, there's so many verticals in the hospital. We say SBU heads. Like I got managers in different departments. I used to say either a department lead or SBU manager. He or she is taking care of ICUs, operation theaters, diagnostics, operation means supply chain management and all. So these kind of specificities are there. And then they gradually move to a business head role or a CEO role or a CEO role. So I think these kind of managers, I think expectations not only from hospital, but I think healthcare is a big space. We require healthcare managers these days in management of insurance companies, number one. We require these people in the management of private equity. If you see for the last few years, I think many private equity is managing the hospital. They're not only parking their money, so they're looking for a hospital manager who understand healthcare, who know what is this hospital operation is all about. So if I as a private equity want to manage some hospital, I require certain hospital manager. So there's certain people on the board of private equities. Then every state, our Union Minister of Health got a team of health advisors, health manager who are taking care of health portfolio. They advise on the healthcare program of the state. So it is a team which is taking care of mother and child segment, private hospital, medical education, over and above healthcare consultancies now. See, if you see the IT part of it, the startup, there was a report, more than 60% people are putting up in the healthcare startup. So where are the people which will come from? They are coming from the management schools. Like one of them is Indian Institute of Management Bodh Gaya, which is they're planning to make the manager in that way. So I think that is very important. We are using drone for different things. Why you are not using drone for transfer laboratory sample from outreach clinic to the hospital? So I think remote patient monitoring is a key. There are so many areas ranging from healthcare IT, healthcare consultancy, insurance companies, equity business, quality managers. We are not talking about only NABH, but the specialties focus. We are generating a stroke standards now. There is a dialysis standard. There is PICU-NICU standards. So I think, and a big chunk of public health. The gap is there. I think somewhere we have to fill this gap through healthcare managers.
This increasing wave of globalization will entail more skilled workforce. And which are the roles where skilled graduates from these schools can fit in? The digital and advanced analytics, strategy roles, brand and therapy management, portfolio development, business development, market access, and also leadership roles. These are some of the roles in my mind where the B school graduates will fit in.
For that, we have to maybe have a look at the RDC continuum, right? The research, development, and commercialization, right? That's how you kind of come up with the product. In each of these domains, let's say focus areas, people who have right talent and right skill set to learn and also create value by what they have learned in the B school can add, whether it is in general management stream, they can pursue a journalist career in research as well. They can pursue a strategic career in research development as well. And more so like market research, providing opportunities, insights, and analytics, forecasting. Like there are a lot of areas I see people can be employed in, right?
So I would say bright future, plenty of opportunities, plenty of roles. And for example, healthcare managers, program managers who are looking after the total hospital administrators, healthcare data analysts, health management consultants, product managers, business analysts, they understand the business also along with the data, market research analysts, business development managers, subject matter pharma quality managers, operations managers, quality improvement manager, at the hospital information manager. These are the areas where we cater to the customers, the projects we undertake, like IT enabled services. They have huge projects from other continents, Europe or US, wherein this digital records of health is already there. It's accessible, it's secure, it's already there. So those projects are there, wherein it's a huge demand of such professionals and whatnot. You can just climb the ladder of this noble profession and you can climb up to the level of COO and CEO.
Obviously, as we gain experience, people try to focus on one domain, one area and build an expertise on it. The way I look at the healthcare program is basically giving you that opportunity in advance. People might look at it as it is narrowing my opportunity. I look at it in an alternate way. Anyway, we are going to focus on one of the opportunities and build on it. It is giving you the opportunity from the very beginning. It is getting you industry ready from the very beginning. Now, in this, if you look at the overall growth, there are a lot of key digital adoption drivers for the healthcare company. Think of things like cost efficiency, care management and delivery, patient experience, rising consumerism in the industry. Telehealth is one of the big things that has come up post-COVID. Virtual care, remote patient monitoring, and all of these things. Optimizing the access to healthcare. So if you look at these key problems that the industry is facing and trying to solve, it is not just a single degree or a single technology that can solve it. You need to have an expand in all these areas, a hold in all these areas, and most importantly, core knowledge of the industry to be able to solve them. If you look at Shark Tank India, a lot of healthcare focused companies have come up with a solution for that. When a person comes out of a MBA program of healthcare management, he or she understands the knowledge of the area and works in an industry, be it IT as a business analyst, be it a hospital as a member, be it one of the pharmacy or any of the providers. He comes with a lot of knowledge, and that knowledge, along with work that he or she sees on the ground, leads to all these innovations.